Good afternoon. Thanks for joining me. This is your County Executive Ed Day. We're bringing to you a weekly COVID-19 update along with other current issues that are affecting our county. Happy September. I know it's hard for most of us to even comprehend that the summer is already near gone. So best wishes for September. I know we have school coming up, and also those of you who are going away next weekend, be safe, be careful for Labor Day weekend, and return home to rock and well. We're going to jump right into the questions today. I'm going to turn things over to John Lyon, my Director of Communications, who's been fielding your questions today. John?
Okay, first thank you to everyone who wrote in today and everyone watching right now or later. Our first question is about new COVID cases here in Rockland. What's the best and most accurate way to see new cases in the county and a breakdown by town or municipality?
Okay, that's great. We have a dashboard that lists the cases by town, municipality, and zip code. You can find that at our website at rocklandgov.com, rocklandgov.com. On the main page, you don't have to go find the health department. You'll see the links on the main page of the website so you can pick it up quick. To see exactly where the new cases are, you need to compare these numbers day by day to see the rise, if that's what you're looking for. But the numbers are updated daily, typically 4 or 5 o'clock, John, roughly. Internally, our health department, through our partnership with our planning department, are able to map these cases to watch for any clusters or spikes that may occur. I know many people are concerned about that, and certainly we share that concern. Health department works diligently through a contact tracing program, which identifies each and every case, notifies their close contacts, and tries to break the chain of transmission. The thinking here, again, as I've said before, we used this during the measles outbreak. Measles is a highly contagious disease, some worse than actually COVID. The bottom line is that they try to track the contacts, and along the way you inform people that there was contact. They ought to take certain steps to minimize further exposure and further spread, and that's how you interrupt the chain of the virus. I will tell you something else. There are a lot of anomalies that happen here. This reporting system is not gospel. This is ComCare, which is a state vendor that we have to work with. They generally do a fairly good job, but for example, we had a spike, I think, a few days ago, or last week, I think it was, last time we did the show. Turned out to be not a spike, turned out to be a batching of reports that came in at one day. So that number was not accurate. When you take that, I think it was 40 some odd people we had, remember correctly, John?
42.
42 people. When you take that and spread it over 6 weeks, suddenly that 42 number of cases falls into a very small percentage with everything else. We just today, you've read about Oneonta College, the SUNY system. Number of young people there have contracted or are testing positive. And let's make sure we understand the difference. Testing positive, you could be asymptomatic or have very mild symptoms. It's as simple as that. The main thing is obviously being contagious. But we found out that some of the young people were putting their names, their addresses at the school, some were putting it at the home. So this is where the challenge is for contact tracing, because we suspect most of our young people, our young students, put the house address down. So we get the paperwork, and we're under the initial impression that I'm trying to think of the word now. The middle of the road, where we're going to be starting our investigation, is going to be from here in Rockland County. When in fact, the middle of the exercise is going to really start up in Oneonta. So these are some things we have to work through at times, and I was thinking of ground zero. That's what I was thinking of. Yeah. So, but each new case, though, is a reminder that we have to remain vigilant. There's no getting around that. We have to learn to live with this disease. Just please continue to use common sense precautions. The bottom line is that we expect you to simply help us get through this by face covering, social distancing. If you can't social distance by 6 feet, wear the face covering. Wash your hands. Don't touch your face with your hands or your eyes. That's how you spread germs. But if you keep doing that, we'll be in good shape. Because again, seemingly, we're one of the worst hit counties in the country, and today we're doing very well. So we should just continue that path, and I think we'll be fine.
Okay. Our next question is in a similar vein. It comes in from someone concerned about the fact that cases are continuing here in Rockland, and are worried about the possible confluence of gyms reopening, students returning to colleges and schools. Do you have concerns about a possible, quote, second wave? And if so, is there a plan in place for Rockland to prevent us from going back to what we saw in March and April and May?
All right. Well, first of all, this is not March, April, or May. This is a whole different ballgame. We know a lot more now, even though we don't have all the answers. I'm not gonna lie to you. Nobody has all the answers here. We're making our best judgments right now. That's what we're doing. But let me immediately assuage your concern. There are plans in place. There have always been plans in place, and they've been moving along quite well. As I stated earlier, our Department of Health and our Planning Department are working very closely together to trace and interrupt the spread of this disease. But we have to understand something. We have to learn to coexist with this virus, not fear it. That's the important message here right now that I'm going to share with you. That is the reality right now. We mentioned it earlier. We mentioned every time we come on to talk about this issue. We respect the virus. We do not fear the virus. There's a big difference here. The plan is very straightforward. It's developed as time goes along, especially plan was during the reopening process. And the governor, I'll quote what he said at the time when he first rolled out the plan of phases 1 through 4. Reopenings would be like a valve. You'll try to open the valve up slowly, which is exactly, if you look at the percentages that are being allowed at various locations, that is a slow opening the valve. With our ability to track this disease now, which we did not have back then, we may see slight increases. Then we can close the valve down. And that's how we keep a handle on this. But to compare where we are now on September 1st to where we were on March 15th, for example, it is clearly apples and oranges. There's no comparison whatsoever. We have many more tools at our disposal. There are numerous websites. Live.rt, that's infection rates across the entire nation. I would urge you to take a look at that site, because it tells you exactly what the infection rates can and can't do, where they should and should not be, and it tells you what to expect from certain numbers. So rt.live, an excellent piece. We're going to continue to keep a close eye on the new cases. Today we spoke about Sonia Oneonta. We looked at a number of those cases that came back to Rockland County, and we'll utilize that contact tracing program, which we do have experience with on top of it, identify the places where the transmission is happening. If it begins to happen in specific places, we will inform the state and make the changes necessary to prevent the exponential spread of disease. We've learned how to slow the spread. Again, washing your hands, soaping up for 20 seconds, maintain social distancing, wear a mask or a face covering if you cannot maintain that. It appears very strongly that these are the habits that got us to where we are now. Where we are now, we're pretty much at negligible infection increases. And again, I think we had 6 people in the hospital. And these are important things to look at. We had over 400 people in our hospitals during the peak of this pandemic. Now we have less than double digits. So again, we go back to how many people are tested. We are testing a lot of people. How many people are testing positive and maybe asymptomatic? Some people testing positive and feel they have a slight cold. So it's the number of infections themselves is a good measure to some extent, but the true, maybe a truer measure is what is the impact? What is happening? Well, we have people getting very sick and being hospitalized. Are we returning to the time where we have to have ventilators brought in? Are we losing people to fatalities? These are a lot of things that are all part and parcel of this challenge. But again, I would just ask people to look at the larger issue here. It's not solely the numbers. The numbers tell us a story, but so do the larger picture of what we see happening when we look at people who are actually contagious and get this disease.
And that's another thing for anyone interested here in Rockland. On rocklandgov.com, there's, in addition to the map dashboard, there's a metric dashboard.
Right.
And that shows the capacity of hospital beds here in Rockland, ICU beds here in Rockland. It gives you a larger view of the picture of what we're experiencing locally.
The short version, the hospitals are empty when it comes to COVID. And that's a great thing. We never thought we'd see that this soon. So it's really a good thing.
Absolutely. And the last question we received today, what are the criteria for the governor to, quote, relinquish his emergency powers? This person's writing about concerns that the state's constitutionally elected representatives haven't had their fair say or input in some of the things he's been doing.
I'm not going to quarrel with that, and I'm not meaning to be critical of the governor, but I happen to agree with what you're saying. There has been an abdication of responsibility in some quarters. Here is chapter and verse of how this works. New York State Executive Law, Section 24, which we'll provide a link to when this video concludes in the comments section. It gives fairly broad powers to a chief executive in the event of a public emergency. That includes the power to establish curfew, regulate and close businesses, places of amusements within specific zones, limit the sale of alcohol, designate emergency shelters, and to suspend local laws or regulations. That power is afforded to all chief executives, yours truly included. And I have used it. I used it during a snowstorm. The intention of it is supposed to be limited, not supposed to be the general rule. We're not supposed to rule by fiat. That's not the way democracy in a republic works. So when we had the snowstorms, we were looking at getting hit at 3 inches an hour at one point. I issued an executive order closing down the roadways at 10 o'clock in the morning. Now, I was cognizant of the fact that many people were at work at that point. We wanted to get as many cars off the road as possible during that critical time of 3 or 4 hours where we were going to get really hit with that storm. And we wanted the plows to get out as unfettered as possible. We initiated the state of emergency. In 6 hours, we lifted it. We had the state of emergency with the measles epidemic, again, tailored towards a health crisis. Again, these powers are limited. These powers are limited to orders to safeguard the health and welfare of the public. Now, the only way that you can end the governor's executive order will be for the state legislature to pass a resolution terminating a specific emergency order. They cannot just say all the orders. They have to pick the ones that they feel are an overreach, per se, in their view. That would have to be passed by the Assembly and the Senate, both houses. So that's how this works. Again, I think it's an advantage, obviously, to have the executive powers under critical circumstances, but just as important, frankly, maybe more important, is that you include other executives and other elected officials as part of the process. That is the part that really is very, very important to do. And I frankly would like to see more of that right now.
Okay. And that will do it for the questions for the day, but I believe there's a couple other things you wanted to mention.
Yes, absolutely. There is. And one is pretty close to my heart for a number of reasons, which I will get to. Child care. Our young people, our children right now are kind of in between along with their parents, with schools, doing virtual schooling, trying to figure out what daycare is going to be when mom and or dad have to be home. Can they work from home or not? Our child care subsidy program is more people than you think would be eligible for this. They are open, and our Department of Social Services is accepting applications for low-income Rockland families. And we know these are challenging times for families. Families may be eligible for subsidy provided by DSS if they are meeting income thresholds and parent or caregiver is working a minimum of 20 hours per week, earning at least minimum wage. I would take this number down. Please call 845-364-2797, 364-2797, and be pre-screened. And you can receive an application, or you can send it by email, which we will post that email address on the comment section also of after this broadcast is over, along with the general information number. This number and email, as I said, you'll be able to look at and get that later on. We recognize the difficulties of working and managing childcare, and this program goes a long way towards helping those most in need. We are doing everything we can here in county government to support residents and our businesses that have reopened, and we will abide by our motto, safety first and people always. The other item also is once you've been approved by DSS, parents should contact Child Care Resources of Rockland County. Child Care Resources connects program participants and parents with over 235 child care programs within the county, including in-home care, child care centers, and programs that can provide for after-school, before or after-school care. For the children, now you should call them at 845-425-0009. Again, 425-0009, or you'll email them also and that's something that we will be posting for you to have. So I would suggest if you have any possibilities for eligibility, make the call or send an email in and find out. Also, here's the concern that I do have. We've heard of parents seeking information on social media or suggesting that they care for children in their homes without knowing about the appropriate licensing and safety regulations. Please do not rely on social media alone. Please contact the professional and knowledgeable staff of child care resources instead. I know it's tough out there doing this, but my concern goes back to my days in the NYPD. I was a detective commander. We saw a lot of heinous crimes in my time. Some of these crimes involve children. And there are inherent risks that children are exposed to. Never forget that criminals that prey upon our children are the most cunning and devious criminals known to the criminal justice system. That is not an understatement, not an overstatement rather. They are. So I just ask you to be very cautious about who you're engaged with, who will be watching your child. I know you are being cautious, but dig deeper. Be very careful. That's what I meant by that. Dig a lot deeper. Make sure that whoever is watching your child is doing the care of your child that you want. That's what it really comes down to. And in times where there's a demand, the supply, the supply chains could be compromised. So just be extra careful. Just take that from an old detective. That's very, very important for you to do that. We have nothing else, John?
There's one other thing I just wanted to mention about child care resources.
Right.
If you reach out to them, the referrals are free. They will talk to you for free. There's no charge for that. They can talk you through the process or what might be available. The same goes with our Department of Social Services. If you have questions, reach out, and we're more than happy to help.
And I also forgot, we got good news today in from for the Halloween season, as we approach it. There's been more allowances made by the governor and his people regards to corn mazes, apple picking, hay rides, things of that nature, things that we enjoy this time of year. So haunted houses are also limited. Pick your own fruit and vegetable farms will be able to open at limited capacity. You can get this information off the forward.ny.gov website. It's been posted. It's being handled much like outdoor zoos, botanical gardens, and the like. So again, go to forward.ny.gov. Look up this information, especially if you're an aficionado of doing the hay rides and doing the apple picking with your family and stuff like that. So I would urge you to take a look at that. We're good? Okay. Well, again, until next week, same time, same station. We'll be on next Tuesday at 4:15 to bring you another COVID-19 update, and we'll be bringing you more information also about the going-ons in the county. Until then, have a wonderful day, and we'll talk soon.